Good morning, Tony.
Good morning, Kevin. Hi. And I note from your earlier introduction before the break that you laid your views clearly on the line.
Yeah, I do. But we're
I hope you'll give me a chance to give.
Of course. That's
my
why
side of the story.
That's why you're here, and I have to be kind to one of my distant relatives. So, but seriously, you are here to make the case for the strikes. I'm not, to make my position clear, I'm not against the doctors, junior doctors getting a pay rise. I mean, let's right off the bat point out that the term junior doctors is somewhat misleading, and that many of them are sort of, middle-aged, and £60,000 a year for a qualified doctor in middle age, and that's what the top earners get. Yeah, I would concede is not enough, but 35%, demanding 35%, that is a bit Alice in Wonderland, isn't it? You're never going to get that. Should there not be more of a spirit of compromise? Because this is the fifth junior strike, junior doctors walkout of the year. Very disruptive, patient safety compromised. What's your stance?
Well, my view of it is that they've laid out, as have other groups in the NHS and other sectors, they've laid out how much the real value of their wage has dropped over the last, for them, 15 years, and it's 35%. So I think that I am not a junior doctor. I'm a retired consultant. I've done my 40 years in the NHS, and I do know what I'm talking about. But I think they are very ready to discuss. They want a government that will own up to its responsibility, because the government is ultimately the manager of the NHS and the decision maker. And I think whatever your views, Kevin, we really have a duty to ask, why is this happening? Why have hundreds and hundreds of thousands of NHS staff across the whole workforce been on strike over the last 10 or 11 months? And why are they asking for not just better pay, but for safe staffing and for a return of the NHS to the position where they feel they go into work with a decent chance of serving their patients properly? And I think there are three reasons. There are three core reasons why the NHS is in the state where 170,000 staff have left in the last year, why over 40,000 nurses have left the NHS in the last year, and why something like 4 in 10 junior doctors are looking for a way out of the situation that they're in. Why, if I was the manager of that service, I would be ashamed of myself. And there are three reasons. There's underfunding of the NHS for the last 13 years compared to need and compared to the significant comparable economies, for example, in Europe. There's been no workforce plan of any integrity until most recently, despite the fact that everybody, all the health think tanks, everybody has been saying there's a growing crisis of workforce numbers and workforce demoralization. And the third thing, despite what you say, that the government has been diverting billions of pounds into the private sector preferentially, rather than building the NHS back to the safe service that it was in 2010 and including up to 2015, really, until after 5 years of austerity at that point, the wheels were starting to come off the NHS. And there have been dire warnings from all angles, from all across the political spectrum. Please support the NHS. That is the safety line, the backstop that allows people to know that they are secure. If they become ill, they will have safe and prompt treatment.
Okay, Tony. I'm not opposed to all the points you made there. But thank you very much. In terms of patient safety, you talked about safety, the safety line. What is troubling for me, and I accept that the doctors are saying, and the nurses in that respect, they're saying, we're worried about patient safety. Well, yes, I accept that you're worried about in the short term, but walking out of hospitals and standing on picket lines in the short term seriously compromises patient safety, obviously, doesn't it? So, really, do we need to mutually, on both sides of the fence, try to work out a way of handling industrial disputes involving frontline medical workers in the future? Because 5 times in a year, demanding 35%, the government, I accept, equally stubborn, you know, well, we're not going to talk about pay, that's ridiculous as well. But so we need a different way of doing this, because it's very troubling that patient safety is being compromised by these strikes.
Well, there's no doubt that the strikes have an impact. I think the moral high ground is with NHS staff that have been willing to say we have to make the government listen, and if they won't come to the table and discuss, then we will have to take that action. I think they are extremely upset. The nurses have been upset, the physios, the radiographers, the cleaning staff, and the doctors. They all. This is the last line of defence. And my plea to the government, even at this late stage, is that as the line manager for this workforce of over 1.3 million people, as the line manager, please take responsibility and talk to them and realise that you don't know actually what you're talking about, that it is in significant danger, that the vast majority of shifts are understaffed. They're going into work each day knowing that there's 7.6 million people.
Yeah, the waiting list.
Please do.